Ethics. New and progressive technology is going to bring up new ethical and moral issues regarding the creation of life, prolonging of life, curing of chronic diseases, ensuring a peaceful death, and ending life. These ethical issues continue to arise as research discovers new methods, possibilities, and procedures, and as people continue to push for the right to make their own decisions. Nurses are seen as an authority on ethical issues because they are medical professionals. So think about how autonomous decision making comes into play in the above or in all of these ethical issues. Again, ethics is going to be that system of standards or moral principles that directs actions as being right or wrong. We are concerned with the meaning of all of these words. Law is considered the minimum ethic that is written and enforced. The Nurse Practice Act, again, is going to be the final authority on a nurse's legal obligations. When we look at a person's ethics and morals, we have to understand that they are subject to change throughout the person's lifetime. The teen years or the adolescent years are going to be a time of trying out family values and either incorporating them or rejecting and replacing them with new values. Very important to understand nursing ethics and legal aspects. Again, the nursing ethics are going to be the values and principles that govern the nursing practice, where the legal aspects are going to be the statutes that apply to licensed persons and situations. Nursing ethics goes beyond the legal implications outlined in the Nurse Practice Act. A nurse may disagree with a patient's beliefs and lifestyles, but nothing should interfere with the nurse's belief in providing good nursing care for all patients. Again, these are areas that you can find ethical codes for nurses. The NAPNIS codes and the NFLPN codes are located in the appendices of your book. Nurse Practice Acts will differ from state to state. So again, and I cannot tell you and stress this enough, that it's important for you to understand the Nurse Practice Act in your state that you will hold a license to practice in. Personal Code of Ethics is going to provide your personal guidelines for living. You ultimately choose what those code of ethics is going to include. If you object to a medical procedure on religious or moral grounds, then you need to make sure that you put it in writing. Doesn't mean that you are going to be able to abandon your client and not provide care, but make sure that you put your objections in writing. Nursing ethics, those in the nursing profession didn't see themselves as having something to contribute to patient care until the nursing process and critical thinking were added to nursing curriculum. In other words, nurses didn't realize or didn't express their importance until the nursing profession began to develop in a more formalized manner. And when nursing ethics was first developed, it was a little bit of this and a little bit of that coming from physicians and professors. So what changed with nursing ethics? We know that when nursing was first started, especially by Florence Nightingale, where it was formally started, that it was disease oriented. We didn't do assessments. The concerns the client had were not routinely looked at by the nursing staff. The clients were expected to do what the doctor said and not question what the doctor's decisions were, and the nurse was expected to see that the doctor's orders were performed. So in other words, in the past, no one but the doctor really had a say in what happened with the client. So what changed? Basically everything. Nurses discovered that they had something to contribute to patient care, and it was something very different from the physician care. Nursing textbooks and curricula both had to change to reflect the nursing process, critical thinking, and this change developed a focus on the total patient, not just the diseased portion of the patient. There are several different ethics committees out there that will help patients and or staff deal with difficult ethical decisions. So if in your practice you come across ethical issues, bring this to the attention of the ethics committee and or sit down and talk with members of the ethics committee to see if they can help you work through the issues. Ethical issues in nursing are more frequently encountered because of advances in life-prolonging technology. An individual's right has become a central theme of healthcare. They have the right to consent to care, the right to choose between alternative treatments. Women have rights over their own bodies, and the right to consent to or refuse treatment. The Western secular belief system has also contributed to the introduction of principles that revolve around personal choice in determining life and death and end-of-life issues. So when you look at ethical and legal responsibilities, you have patient advocacy, where the patient needs to be informed of what you're doing with him or her. In other words, what are the steps of the procedure, what can they expect, etc. Excuse me. And if they're not able to speak out for themselves, then we as nurses need to do that for them. Accountability. You are answerable to yourself, to your assigned patient, to the team leader, to the physician, and to your instructor who will evaluate your work. And peer reporting. We need to report our peers for behaviors that are potentially harmful to patients. And we can't look at, well, I really like that person and I don't want that person to get in trouble. We have to look beyond that and look toward the safety of the patient. That doesn't mean that we are going to be spies and we're going to be searching out information that could be potentially harmful, and we're not tattletales. But at the same time, we cannot allow unsafe patient care to be delivered morally or ethically. Excuse me. So the big question is to what extent do one's individual moral decisions or rights get in the way of another's moral autonomy? Final ethical decisions are outside the scope of practice of the practical nurse. Remember, ethics is what you ought to do, and the law is what you have to do. Learning about ethics is more than being able to recite the definition. There's more to ethics than just being able to pass a test. You've got to be able to make those decisions when those dilemmas arise. So we look at non-maleficence, which is do no harm. We, as nurses, unfortunately, end up doing some harm to patients, such as when we have to give them an injection. It's going to hurt, so we're harming the patient, but yet the medication that we're injecting is ultimately going to help. So it's a difficult principle to strictly adhere to. It's because healthcare professionals are required to perform something that is perceived as harmful as we are trying to improve the client's condition. Some of these examples are listed here. The most common belief in nursing should be that the client's needs come first, before the nurse's personal or professional needs of the moment. In other words, if the client requires something, that means that you can't go sit down and take that break until the client's needs are taken care of. It is very commonly understood that a lot of nurses miss lunch, or a lot of nurses don't even have time for a bathroom break when the client's needs outweigh their own. Administrative or paperwork requirements, although inconvenient, should wait until the client's needs have been met. So these are the 4 steps of the autonomous decision. In other words, as the patient is trying to determine what should be done, they should go through these 4 steps. In order to make an autonomous decision, an individual should have all of the facts, but that does not mean that a client can do whatever he or she wants. We look at the client's right to privacy. They should choose their care based on personal beliefs. They have the right to accept or reject treatment and avoid needless exposure. Their personal values. They can refuse care for religious, cultural, or personal reasons. When we look at fidelity, many nurses will find fidelity to be extremely frustrating at times, especially when family members begin to challenge medical opinions. Talking to a nursing colleague or supervisor can actually help a nurse maintain perspective in situations. With justice, treating each client with justice will enable the nurse to minimize psychological stress, because the nurse can feel confident that he or she has provided the best patient care possible. Beneficent paternalism is where we try and tell the client that we know the best way that things should be done, or we're influencing a client to make a decision that we feel is appropriate versus what they feel is appropriate. Paternalism and women's health. Your responsibility always is going to be to advocate for your female client. Women were seen as victims of their own body historically, and they couldn't help being sick. So the male way of thinking was that men knew better than women, and the physicians were the ones who defined what was normal from their perspective, which basically was anything that was different from men, and it was considered to be an illness. Things have really changed. Thank goodness.